Hello, this is Dr. Kim Jeong-gil. Today we will look at strategic leveling and alignment. In Part 1, we will look at the use of open coil spring. There are two bonding methods when starting orthodontic treatment: full bonding and strategic bonding. Full bonding means attaching brackets to all teeth. On the other hand, selective bonding or strategic bonding means not attaching brackets to some teeth selectively for a purpose. In general, many orthodontists choose full bonding. How does the tooth move with full bonding? Because the incisors are smaller and weaker than the molars, the mandibular incisors are more likely to be labially inclined. At this point, the POP will not change significantly. In MEAW orthodontics, full bonding is called simple leveling. This is a patient with a deep curve of SPE. How will the teeth move with full bonding? During diagnosis, it was decided to carry out non-extraction treatment because the current profile was acceptable. If brackets are attached to all teeth are leveled according to the posterior teeth, and the possibility of labial inclination of the mandibular incisors increases. What does the labiversion of the mandibular incisors mean? It means unaesthetic profile. It is the same in the maxilla. In general, SWI brackets for the upper molars are programmed with rotation offset bend. In other words, mesially rotated teeth are derotated distally. We want tooth movement like this, but if you do full bonding, how will the teeth move? In some cases, the molars become distally rotated, but in many cases the posterior teeth do not move and the anterior teeth are more likely to incline labially. On the other hand, in strategic leveling, the tooth in front of the terminal molar, first molar or second premolar, is not bonded at first in order to use open coil spring in that area to upright the terminal molar. These two figures show different approaches of using open coil spring in the first molar area to upright the second molar. What is the difference between figures A and B? In A, the anterior crowding is not resolved before using open coil spring in the first molar area. But in B, the anterior teeth are aligned beforehand. What is the difference? In A, the mesially angulated lower second molar is slightly uprighted, but there is a high chance of further mesial angulation of the lower second premolar. On the other hand, in B, the aligned anterior 8 to 10 teeth act as a unit anchorage. So the mesially angulated second molar is more easily uprighted, although the anterior teeth move slightly forward. Therefore, strategic leveling means aligning the anterior teeth before using open coil spring in the posterior teeth, as in B rather than A. There are two main things to remember about strategic leveling and alignment: strategic bonding and adequate use of open coil spring. In this part, we will mainly look at the use of open coil springs. In the intraoral photos, there is a crowding on tooth 13 in the upper right quadrant, but there is no crowding in the upper left quadrant. Therefore, all teeth in the upper left quadrant can be bonded, but space has to be gained in the upper right quadrant in order to resolve crowding on tooth 13. The incisors can be moved anteriorly or the first premolar can be moved posteriorly. In order to move the first premolar posteriorly, the second premolar should not be bonded. Predictable treatment results can be obtained through strategic bonding and strategic leveling. In other words, the brackets should be bonded strategically, according to the patient's treatment goal rather than fully bonding. The first thing you need to know for strategic bonding is the use of open coil springs. Open coil springs are usually used to make space, and arch wires of at least 0.16 inch or thicker must be used. When opening the space, the amount of force can be approximated by adding 1/3 of the inter-bracket distance. Open coil spring is used mainly for three purposes. First, it is used to make room for decrowding if there is a crowding. Second, it is used to upright mesally angulated teeth. Third, it is used for derotation of mesally rotated teeth. 1. In case of crowding, open coil spring is used to create space for one or two teeth. The incisors can be slightly labially inclined, and the arch becomes expanded. In the intraoral photos, crowding on teeth 13 and 23 is observed. In order to align teeth 13 and 23, brackets were attached on the upper central incisors, lateral incisors, first premolars, and first molars. Teeth 15 and 25 were not bonded. After initial alignment, open coil springs are used on teeth 13 and 23 areas. How do teeth move? The incisors move anteriorly, and the first premolars move posteriorly. When moving the first premolar backward, do not attach the bracket to the second premolar. Because it is difficult to move the first premolar backwards if a bracket is attached to the second premolar. In this way, it is possible to arrange the upper and lower anterior teeth, while maintaining their positions as much as possible. 2. Open coil spring can be used to upright the mesally angulated molars. The lower first premolar and second molar are often mesally angulated. In order to upright these two teeth, the teeth in front first molar and canine are not bonded, so that open coil springs can be used in these areas. This can also be applied in cases of premolar extraction. When the lower second premolar is extracted, uprighting of the mesally angulated lower first premolar can not only close some of the extraction space, but also resolve the anterior crowding. 3. Open coil spring can be used to derotate the mesally rotated teeth. Which teeth are frequently mesally rotated? The upper first molar and second molar are often mesally rotated. The teeth in front first molar and second premolar are not bonded, so that open coil springs can be used in these areas to derotate the mesally rotated teeth. When the upper first molars are mesally rotated, the brackets are first attached to the upper central incisors, lateral incisors, canines, and first molars. Since the crowding on the second premolar is severe, it is better not to attach a bracket to the first premolar at first. If the first premolar is bonded, an open coil spring is used between the first premolar and first molar. The use of open coil spring is less effective due to short interbracket span. Since adequate length is required to use open coil spring, it is easier to derotate the mesally rotated first molar by attaching brackets to the upper central incisors, lateral incisors, canines, and first molars and using open coil springs. There are many cases of unilateral crowding. In the intraoral photos, crowding on tooth 13 is observed. In some patients, the first premolars are mesally rotated or the lateral incisors are distally rotated. In this case, brackets are attached to the central incisors, lateral incisors, first premolars, and first molars. Then open coil spring is used in the canine area to derotate the mesally or distally rotated teeth and upright the mesally angulated upper first premolars and distally angulated upper lateral incisors. Let's think about full bonding and strategic bonding. In full bonding, super-elastic archways generally use. How do the teeth move? The applied force will move the upper canine palatally. As a reaction, the upper lateral incisor and first premolar will be moved labially. When viewed from the side, the force will extrude the upper canine, while intruding the lateral incisor and first premolar. As a result, there is a high chance of lateral open bite. On the other hand, in strategic bonding, by maintaining the original arch form and using nitty overlay arch wire, the labially crowded canine can be moved into the original arch form. From the side as well, lateral open bite is prevented by leveling the upper canine while maintaining the occlusal plane. Therefore, rather than full bonding and using super-elastic arch wire, I recommend strategic bonding and use of open coil spring to create space. If open coil spring is used, the arch becomes expanded. In order to evaluate the width of the arch, the active centric line is evaluated in the mandible. The active centric line of the mandible is the circle connecting the incisal edges, buccal cusp tips, and contact points between the first and second molars. It is advisable to treat while maintaining this circle as much as possible. Since the premolars are lingually inclined in this patient, the treatment should allow slight buccal movement of the premolars. To do this, how should you treat? Non-extraction treatment should be carried out. In this case, it is better to treat with non-extraction approach even if there is a crowding. Basically, there are two methods of gaining space in case of crowding. It is either expansion appliance or arch enlargement, although the upper second molars are derotated by the use of expansion appliance. The amount of derotation is not much. In MEAW orthodontics, the mesially rotated second molars are first derotated so that the arch is enlarged accordingly. This is called arch enlargement. By first aligning the anterior teeth and using open coil spring in the first molar area, the mesially rotated or angulated second molar can be uprighted or derotated. Let's look at the prex panoramic X-ray. Medial angulation of the lower molars is observed. In this case, by using open coil spring in the lower first molar, the second molar can be slightly uprighted. The use of open coil spring to create space can be largely categorized into using in the anterior teeth and posterior teeth. In MEAW orthodontics, it is basic to use open coil spring in the posterior teeth. This will upright the mesially angulated teeth and derotate the mesially rotated teeth. These two treatment effects can be achieved simultaneously. When using open coil spring in the anterior teeth, there are cases of crowding and no crowding. If there is no crowding, the brackets are attached between the second premolars, and only the first molars are not bonded. As a result, the treatment duration becomes much shorter. If there is crowding, the anterior crowding should be resolved first, and then open coil spring is used in the first molar area. Let's take a look at the force vector when using open coil spring. A is unilateral crowding. Because B is bilateral crowding, open coil springs are used on both sides. How do the teeth move if open coil spring is used unilaterally? The incisors are slightly labially inclined, but the amount of lateral movement is larger. On the other hand, if the open coil spring is used bilaterally, the incisors are more likely to be labially inclined. Therefore, care must be taken when using open coil spring bilaterally. Cinch back bend is bending the archwire behind the terminal molar to eliminate patient discomfort. In MEAW orthodontics, Weingart utility plier is used. If a cinch back bend is made toward the cheek, the patient feels discomfort. Therefore, in the upper arch, cinch back bend should first be performed slightly inward, and then gingivally to reduce discomfort. There is a term of tight cinch back bend. As in the figure, there are many cases of crowding in the upper arch. If this crowding can be resolved, non-extraction treatment becomes easy. In this case, open coil spring is generally used in the lateral incisor area to create space. In MEAW orthodontics as well, open coil spring is used in the lateral incisor area. However, the brackets are strategically attached to the central incisors, canines, second premolars, and second molars. If the teeth are fully bonded, the likelihood of labioversion of the upper incisors increases. After ligating the teeth, cinch back bend is made on one side, and then the wire is pulled on the other side and cinch back bend is tightly formed. This is called tight cinch back bend. In this way, the arch perimeter between the second molars is maintained, and the space is created more by posterior movement of the canines than labioversion of the incisors. In other words, it is easier to obtain space with current position of the anterior teeth. After the lateral incisor is aligned, open coil spring used in the first molar area. At this time, loose cinch back bend is used to derotate and upright the mesially rotated and angulated second molar. This is how to perform loose cinch back bend. Ligate one central incisor, and then perform cinch back bend on both ends. Ligate one central incisor, and then perform cinch back bend on both ends. When the rest of the teeth are ligated, the wire extends slightly distal to the ends. When using open coil spring, the magnitude of the force should basically be considered. The distance between the brackets is called the interbracket distance. Making space for a single tooth or two or more teeth should be considered separately. When making a space for a single tooth, the length of open coil spring should be a bracket width longer than the interbracket distance. For two or more teeth, add 1/3 of the length of the interbracket distance. Which main arch wire should be used when using open coil spring? I mainly use three types of arch wire. The first arch wire is a 0.16 inch SS arch wire. The purpose of this arch wire is resolving anterior crowding and uprighting and derotation of the lower molars. In particular, 0.16 inch SS arch wire is mainly used to create space to resolve anterior crowding. In this case, tight cinch back is possible. On the other hand, tight cinch back cannot be performed on 0.16, 0.22 SS, and 0.16 nitty arch wires. What happens in this case? There is a high chance of labioversion of the incisors. After aligning the anterior teeth, open coil spring can be used in the first molar area on 0.16 nitty arch wire. In the case in the center, strategic leveling is performed by derotating the first molar after the upper canine erupts. However, since it takes a long time for the upper canine to erupt, the first molar should first be derotated. In this case, open coil spring should be used in 4 areas to derotate the first molar, but the likelihood of labioversion of the incisors increases. Therefore, in order to minimize labioversion of the incisors, torque is adjusted on 0.16-0.22 ss arch wire. Let's look at the figures. In the first figure, open coil spring with loose cinch back is used on 0.16 niti arch wire to derotate the first molar. In the second figure, there is an upper anterior crowding and 16 ss arch wire with tight cinch back bend is used to create space while minimizing labioversion of the incisors. In the third figure, 16-22 ss arch wire is used when using 2 open coil springs on each side, total of 4 open coil springs. In this case, crown lingual torque should be applied on the anterior teeth and loose cinch back bend should be performed. Crown lingual torque is applied on the anterior teeth when using 16-22 ss arch wire. By applying crown lingual torque, the crown moves lingually and the root moves labially. Figure A shows standard bracket and Figure B shows SWI bracket. Compared with B, labioversion of the incisors is minimized in A by using open coil spring with crown lingual torque on the anterior teeth. There is a higher chance of root labial movement. Many orthodontists use open coil spring with SWI brackets on performed arch wire, and sometimes the chance of labioversion of the incisors increases. Therefore, by using open coil spring with 0° standard brackets and crown lingual torque on the anterior teeth, the roots of the upper incisors move labially and labial movement of the crowns is minimized. After a month of use of open coil spring, the amount of residual activation is assessed, and it can be activated without changing the arch wire if necessary. The activation can be performed by inserting an activation spacer or a sliding hook on the main arch wire. Let's review. What is strategic leveling and alignment? It is the efficient use of strategic bonding and open coil spring. When using open coil spring, it should be considered whether to perform tight cinch back or loose cinch back. In other words, in order to minimize labioversion of the incisors, tight cinch back bend should be performed. Open coil spring can be used for the following purposes. 1. To make space for anterior teeth. 2. To upright the mesially angulated teeth. 3. To derotate the mesially rotated teeth. In case of curve of Spee, the curve should be flattened. But simple leveling will likely lead to minimal change of the molars and high chance of labioversion of the incisors. On the other hand, in strategic leveling, the amount of labioversion of the incisors is less, and the mesially angulated teeth can be uprighted. In terms of POP, it means that POP can be changed, that is, steep POP can be turned into flat POP. MEIWY has many advantages. To further maximize the advantages of MEIWY, strategic leveling and alignment should be performed first. Strategic leveling means first using open coil spring in front of the mesially angulated and rotated teeth in order to upright and derotate, and then using MEIWY with tip back activation to further upright and derotate these teeth. The order of my orthodontic treatment is strategic leveling and alignment, finishing with MEIW. First, evaluate anterior crowding, and the treatment becomes relatively easier if there is no anterior crowding. The brackets are attached between the second premolars, and open coil spring is used in the first molar area to upright and derotate the second molar. In case of anterior crowding, the anterior teeth should be aligned prior to the use of open coil Spring in the first molar area. The caveat is minimizing labioversion of the incisors when creating space for alignment. In order to create space, miniscrew or expansion appliance can be used. However, keep in mind that the basics are strategic leveling and alignment. Thank you for watching.